Last week, a prominent scientist who identified the first breast cancer gene recommended that certain women get tested for genetic mutations that can cause breast cancer.
Joining us to talk more about this and this kind of testing, registered nurse Carla Stuart with East Texas Medical Center's Cancer Institute. Nice to have you here, by the way.
Thanks for coming.
Thank you.
How big, Carla, a breakthrough is identifying this gene? What does it mean for further cancer prevention and cancer research?
Well, BRCA testing has been around for a while. However, what's changed recently is in the past they were testing women who had breast cancer and maybe were young and there was a concern for hereditary genes, so they would test them. Now what's happening is with the push for healthcare changes of prevention and early detection, genetic testing is being offered to women who have a strong family history even when they don't have cancer. And so that's something new as of this year.
Now,
so we're excited about that.
Yeah, that's very exciting. How important is it to know your family history genetically?
It's very important, and the reason for that is because the qualifications or determinations for doing the test rely on your family history. It's important to know not only your family history from your mother's side, but also your father's side, because it includes both sides of the family. Another thing that's also very important that is something that where people may have to call their family members to find out is at what age they were diagnosed, because if the person who has cancer was younger, then the chances for a genetic gene mutation is actually more prominent.
A lot of folks frankly don't like going to hospitals, don't like going to clinics, don't like going to see doctors, don't like testing of any sorts. Are there any risk from something like this, a test like this?
Well, I'm happy to report that at the ETMC Breast Center, we do our genetic testing that only takes a couple of minutes, and I can say that it is painless. It is done by an oral rinse.
There you go. No needles
believe me.
involved. Thank you very much. Yeah.
Right. It is. We don't do it by blood test, although it can be done that way.
Right.
But it involves an oral rinse, and that obtains the genes, loosens the genes off the inside of your mouth, and those are sent to be tested.
Now, when you say certain women, you know, if I'm at home watching the show, how do I know if I should go get this tested?
Well, the National Coalition of Cancer Network has guidelines, and they're pretty in-depth, so I'll talk about some general things. If you have a family history of cancer, then you need to go ahead and have a genetic screening done, and we do that at the breast center. Women who are particularly at risk are women who have a history of ovarian cancer in their family, because ovarian cancer is actually in the general population very rare. It's less than 1%.
Oh, big.
However, if you have a BRCA1 BRCA gene mutation, it can be as high as 11 to 44%.
Oh my, that really does raise the odds. Gosh.
And for the population, the general population, for someone who has no breast cancer history, they're about 8% risk of having cancer. If you have a genetic mutation of BRCA1 or BRCA2, that increase your risk to anywhere from 45 to 87%.
We can learn more, though, at East Texas Medical Center Breast Care Center. Right here in Tyler,
Absolutely.
right? The number 903-596-3009 or etmc.org. Thank you for coming in. Nice to see you.
Thank you.
Thank you very much.